Welcome back to Family Planning and Abortion for Medical Students. Today, we will be continuing our mini-series on family planning and contraception by talking about sterilization. We will be the following learning objectives from APGO Topic 33, Family Planning, including describing the methods of male and female surgical sterilization, as well as explaining the risk and benefits of female surgical sterilization procedures. By the end of this video, you should be able to understand the basics of both types of sterilization procedures, the risks, benefits, and complications of both of these procedures. We'll start with vasectomies. For people with penises, the only method of sterilization available is a vasectomy. This is a procedure in which the vas deferens is cut and tied off. This separates the epididymis, where sperm are stored, from the ejaculatory duct, where sperm are eventually ejaculated through the urethra. This procedure is outpatient and performed under general anesthesia, usually by a urologist. A vasectomy can be performed without a scalpel, which provides the benefit of not having stitches. With a vasectomy, semen is still produced and ejaculated, as the seminal vesicles and prostate secretions are not interrupted. A patient should return to clinic 3 months later to ensure no sperm are present in the ejaculate, as this is about how long it takes on average for sperm to clear the reproductive system. The procedure can be reversed by reanastomosis of the vas deferens with moderate success, with success rates improving with less time between the original procedure and the reversal. Some of the advantages of this method are that it is very safe, more than 99% effective, permanent, requires virtually no maintenance after the initial procedure and 3-month visit. It is cost-effective and can be private from a partner. Disadvantages are that it does not provide STD protection. It does require a procedure and a follow-up visit. It could cause regret in those who undergo the procedure and does have some complications, which we will talk about next. While these complications are not common, it is important to mention when counseling patients. The most common complication is hematoma, which is less common in the no-scalpel version of this procedure. Other complications include infection, which is also less common in the no-scalpel version, and sperm granuloma, which is when sperm leaks out of the vas deferens and causes an inflammatory reaction that usually goes away but can still be pretty painful. Swelling of the epididymis can also occur, as well as post-vasectomy pain syndrome. Failure of the procedure through a technical error, the rejoining of ligated ends of the vas deferens, or unprotected intercourse before checking for absence of sperm are all also possible. Next, we'll talk about tubal ligation. For people with uteruses, there were 2 closely related methods of sterilization, tubal ligation and tubal implant. Tubal ligation involves banding, cauterizing, tying and cutting, or clipping the fallopian tubes so that sperm cannot travel to the ovaries to fertilize an egg. The other form of permanent birth control that was previously used in the US was called a tubal implant, which went by the brand name of Essure. This method involved a small coil being placed in the fallopian tube, causing scar tissue to form and physically blocking the tubes so sperm could not travel to the ovaries. This method is no longer on the market due to side effects and some cases of migration of the implant, but it is worth mentioning as you may encounter patients whose implant is still functional and in place. Tubal ligation is the preferred method of sterilization in the US and is effective immediately, unlike vasectomy. Tubal ligation is a fairly simple outpatient procedure performed under local or general anesthesia. Like a vasectomy, some forms of tubal ligation can be reversed. However, the success rates are much lower and depend on the age of the patient and the length of remaining healthy tubes. A quick note on postpartum tubal ligation. This is a fantastic option for people who have just delivered a child and want permanent birth control immediately afterwards. For example, a person who is nearing the delivery of their 3rd child and is absolutely sure that they do not want to be pregnant again may choose this option post-delivery. This is an ideal time for this type of contraception because the procedure is easier postpartum than at other times. This can be done 2 different ways depending on the method of delivery. With a vaginal, a procedure called a mini laparotomy is performed, in which a small incision is made in the abdomen. Postpartum is an ideal time for tubal ligation because the uterus and fallopian tubes are located just under the abdominal wall and are easier to get to, whereas a few hours to days later, the fallopian tubes and uterus move back into their normal location. With a cesarean delivery, the tubal ligation can occur through the same incision used to deliver the baby. This is obviously much easier postpartum as the fallopian tubes are already exposed and can easily be ligated. Both procedures take approximately 30 minutes and have the same complications of tubal ligations in general, which we will discuss next. Advantages of this procedure include that it is safe and effective, has virtually no maintenance, is private, and has few side effects. Disadvantages include lack of STD protection and some post-procedural risks and other complications, which we'll talk about next. Immediate complications post-procedure include bleeding from the fallopian tubes, injury to nearby structures, post-op pain from the incision site or ischemic tubal tissue, and conversion to laparotomy. Delayed complications include ectopic pregnancy, simply because it is more likely for an egg, if fertilized, to get stuck in the fallopian tubes, as it would not be able to reach the uterus, as well as failure via recanalization of the tubes. Failure of tubal ligation and subsequent pregnancy is also possible. Thanks for listening. Please check out the resources if you want more information, and don't forget to tune into the next video as we wrap up this mini-series by summarizing the general themes of choosing contraception and practicing our knowledge with some cases.